welcome back to Aging, Healthcare, and Everything in Between, where we talk about the things that help families live well throughout their retirement years. I'm your host, Stephanie Pogue. Let me start with a question for the listeners. Have you ever heard a loved one say, I guess I'm just getting older, right? Maybe you're seeing them more tired than they used to be, sleeping more often, maybe they're not sleeping well, maybe they're having a little bit of trouble with their balance, or they've had a fall recently, or maybe their memory is just not quite as sharp. We all just assume that these are part of aging. All these symptoms are just signs of aging. But what if they're not just getting older? What if it's their medications? So today my guest is Dr. Hedva Barenholtz Levy. She is a board-certified geriatric pharmacist who has spent decades helping older adults safely manage their medications. And she's written this book called Maybe It's Your Medications. I love this book. I think it explains a lot about prescriptions, but what it really does is help you become a better advocate for yourself. So, Dr. Levy, welcome. Tell me a little bit about your credentials and what caused you to write this book.
Thanks, Stephanie. I'm happy to talk about it because I always say I get to talk about what I love most, which is drugs, but not in the way we think about that sense, because I'm in many ways against drugs. We have to really think about the medicines. So I am a geriatric specialist pharmacist, as you mentioned. I work with older adults in their homes to do a real thorough evaluation of the medications they take. And I also love to emphasize that includes the non-prescription drugs as well as the prescription medicines. So that's a real important aspect of drug safety. But over decades of working with people in their homes, and I help them identify medication-related problems, which is a whole range of issues that can prevent people from really benefiting from the drug therapy that the doctors have prescribed. So I help them identify these problems and correct those problems with their doctors to make sure they're taking medicines that are helpful and that aren't causing problems, which we'll be getting into, of course. So it's, and I'm a part-time faculty at the College of Pharmacy here in St. Louis, so I love teaching, and I've always been, and I teach my patients, my clients a lot. It's a large part of what I do, educating them about their medications. So the book came so naturally for me. I mean, when I look back, it's a huge project, but it's my baby, and it's out there now. Really you mentioned the word advocate, to help people understand their medications, to know what questions to ask, because in many ways I am a patient advocate to help them recognize we've got to talk about our medications. And so this book came together very naturally as a way to help people, the ones I can't reach everybody, right? But I can kind of put the book out there as a resource for people who don't know what questions to ask, why there might even be an issue with medicines. Like you mentioned, a lot of times people have symptoms and they think, I'm just getting older. So I love the title, is really cool as well, this concept, maybe it's your medications, just to get people to think about that.
Yeah. So what do you think the biggest misconception is that people have about medications as they're getting older?
The misconception? Yeah. It's very interesting. I think people have, we need to trust our medications, absolutely, because we know that they do a lot of good. But I think people assume that the benefit and the safety is much greater than it often is, if that makes sense. So there's a lot of taking it for granted. Well, the doctor prescribed it for me, so it must be fine, and I will take it. But there's a level of getting involved with your medications that is really important in order to use them safely. So I think about things like, well, why is it being prescribed? You can imagine how many people I work with who really don't have an idea of why they're taking a number of their medications, right? Some will say, I don't know anything about any of them, I just take them. And that's always concerning to me, because you can understand why you're taking it. And because the next question is it helping or not? Right? So knowing why you're taking a medicine, what are we monitoring or looking for to know if it's helpful? And the flip side of that is, what do we need to know about side effects to know if it's not helping or causing a problem? Or if it's a very common side effect, know about that and then know how to manage it. But if it's something that is impacting the quality of life or maybe causing another problem that we don't recognize as a side effect, it's really important to question and re-question. So re-prescribe medications like every year. I think it's an annual checkup is a great idea, where you talk with your doctor about re-prescribing things. Stop kind of looking at everything anew. Shall we continue it? Is it of value to you? Because we all change. Every year we're a little bit different. We're at least another year older, and maybe our other health has changed, other health conditions have changed, or our kidney function has changed, or we're taking other supplements, or maybe we're eating better and exercising more. So those things can all impact the need to continue these long-term medications.
Yes, I think all of that is so important. I see, as a Medicare agent, I look at people's prescription lists all day, all the time. And I can't tell you, just like you said, how many times they will say, I'm not really sure what this one's for. Can you look it up?
Exactly, yeah.
And I think that you have to understand what you're taking, why you're taking it, and be prescribing everything. That's a great idea. Have the doctor really look at everything, because I know they're busy. A lot of times there's multiple doctors, right? You have a cardiologist, you have all different types of doctors prescribing. But when you run into people who have 3 different types of diabetic medications and they're not working, maybe they don't need a 4th one.
Right. And often we have to dig a little bit. So if you're on 3 medicines to treat blood pressure or diabetes, are you really taking it every day? And the other piece, are you taking it correctly? And there's certain medications that you have to take in a very specific way for the drug to be effective. And some blood pressure medicines, not as critical, but I think I always use the example of certain osteoporosis medications for thinning or weak bones. There's a group of medications that are commonly used that, when taken in the pill form, have to be taken very specifically in the morning with no other foods, no other medications, just water, and then sit upright and all this wonderful stuff. Anyone who takes one of those medicines will know exactly what I'm talking about. But I met with a woman who for 2 years was taking it at lunchtime every Sunday. It was once a week medication with her lunch. And it never came out until I was in her home really drilling down with her. How are you taking these medicines? So sometimes we just don't know. But yes, for sure that adherence is the term that what we refer to with following those instructions. Are you taking the medicines? A lot of people I talk to may be skipping doses or have stopped a medicine because they have side effects or it's too expensive. They don't like the way it makes them feel. Not sure they need it. So then they're not following through with what the doctor thinks they're taking, right? So that communication becomes a really important component of care and being, I guess, advocating for yourself with your doctor.
Yeah, because then the doctor could think, well, that medication's not working, when really you're just not taking it or taking it every other day or whatever. And this is where we, as caregivers for aging parents, can really step in and help out. Make sure that they are, it's hard to take them to know, I guess, when to take everything. You're listening to the doctor and there's so much information. Not everybody reads the inserts, but it's all so important, and we need to step in and maybe help out.
And sometimes those inserts, the long list you get with your stapled to the bag from the pharmacy, can almost be a deterrent for some people. I don't want to get all those side effects, right? So it's a little scary. So I always think you got to know what's applicable mostly for you and what are the main concerns. But right, it's that managing your medicines at home that can be overwhelming for some people. So it's important. One of the conversations I always have is, how do you remember to take your medications? How do you organize your medicines at home? So those adherence aids, those pill organizers can be so helpful. I worked with a client recently who really didn't even have a good written medication list of everything he was taking. So, I always like to leave people with really important, valuable tools things they can just make sure they're doing today. And one of those tricks is having a really good medication list that you have in front of you, that's always updated, that you carry with you to help start sorting out when to take your medicines. So that's really important, and having a routine. So working with our parents, how are the meds organized and how are they taking them every day, mom and dad, and how can we help? So certainly
because
we can do.
It could be also really hard for them to see that little pill, or to maybe with arthritis, to be able to get them in the little pill boxes, or if one falls on the floor. I think I read that in your book. One of them, it falls on the floor and they just think, well, I'll skip it today, it's fine. If that happens a lot, that could be a problem.
Then you're missing your drug therapy, exactly, or you don't recognize because of vision or the tactile changes, maybe neuropathy, numbness, or something. You don't even know that you're missing some medications, and that's the piece that I've seen an awful lot is people don't know what they don't know. They don't know that they're kind of, I don't want to say messing up at home, but they're making mistakes that are very innocent mistakes, right? And it may not come out until you're talking with somebody. I'd like to say talk with your pharmacist about your medicines and how you're taking them, but certainly at the doctor's office as much as you can.
Yeah, I know we had this problem with my aunt because she was on 2 blood pressure medications and she kept saying, I'm taking them every day, but yet her blood pressure was uncontrolled. Well, it turns out she wasn't. She couldn't figure out which one was which in the bottles, and she couldn't get them in the little pill organizers, and she wasn't taking them. So
sitting over
really
there.
Important to drill down.
Yeah, and to think about, to not be afraid to say, I have arthritis or my hands are weak, I can't open those pill bottles. When you talk to the pharmacy, they can make adaptations and get you non-child-proof caps if necessary. And again, as children, I think it's really great if we can help mom and dad fill those pill organizers every week when we're visiting or something, to make it easier for them, and just say, I'm sharing, I want to share this with you, and I love you, I want to help you out. So that's a great way to help out, I think.
So then how do you know if something is just normal aging or if it is a side effect of a medication? What are we looking for?
Well,
I know it's a broad question.
Right. And I'm thinking, well, it's a very good question, right? Because that's something we're all kind of thinking about. But one, I think it's important to recognize that maybe it is the medications, again, coming back to the title, rather than just making that assumption. I'm getting older, of course I'm tired, or I'm more constipated now, or my appetite's not as big as it used to be. But certainly memory and gait stability, right? Walking and the fall risk are huge concerns as we get older. As a pharmacist, I'm always going to look at any new symptom as if it could be a medication side effect. So one idea is the more healthcare members of our healthcare team that are kind of looking at a person's symptoms and how they're changing as they get older, the more different perspectives. I'm going to look at it from the medications and make that assumption. A physical therapist is going to look at muscle strength and physical abilities and things like that, right? So everyone's going to look a little different. The physician's going to come in and look probably often more for diagnoses. It's a new health condition that we have to diagnose and then treat. So how do you tell? And it gets tricky. So this is why geriatrics, it's a field of medicine for people 65 and older. So that's our healthcare cutoff for older adults, if you will. Side effects can be very subtle, which is scary. And the timeline can be less predictable. So certainly if you're starting a new medicine, be aware of, again, what is it supposed to help, so I know what I'm looking for, and then what are some side effects. So that's where talking with the pharmacist as well as the physician to have a sense of what kinds of symptoms I might be looking for. Often, stomach upset or maybe a rash, dry eyes. If you're aware of that, then maybe it's that medicine, right? It's not aging, so you can bring that up. Unfortunately, sometimes medicines people have been on for years even can have a side effect after time, right? It doesn't have to it's not always going to occur within days, weeks, or months of starting a medicine, which makes it a little tricky. So I always say, when I'm working with clients, I'm going to always look at all of their medicines. When were they started? How long have you been on it? What has changed in that time period? I mentioned earlier, maybe there's lifestyle changes. So people are maybe eating better. They've lost some weight. They're healthier. I've had patients who were taking too many blood pressure medicines after losing weight and taking on some better lifestyle choices. And they were getting dizzy and falling because the blood pressure medicines were just too intense for where they were now versus where they were 5 years ago. So I'm always going to question the medicine. How do you, as consumers, know? I think it's important to, we know. Let's see, how do I word this? You know how you feel every day and day to day, and if something feels different, it could be the medication. So it's always something to question. Could it be any of the medicines I'm taking? What was added most recently? So that's certainly a first place to start, because there could be that time-related connection. But I just threw in that story of how it could be years later, because we need to still look at everything the person's taking. Maybe it's something else. Maybe it's an interaction that is causing a level of a medicine to increase that now is causing a side effect, if that makes sense. And I have a chapter, I talk about interactions, a whole chapter about the different types of interactions and how they can occur. And some are slow to occur and some are more quick to occur. So not the easiest answer, but at least some things for us to think about, I hope.
Yeah. So if you're working, you're talking to your parent or whatever, and they say, I'm just feeling off, or it's worth talking to the pharmacist, talking to the doctor. It's worth asking questions, right? Not just say, oh, they're just.
Absolutely. Right. Have that curious mind. And I like to say a healthy dose of skepticism about the medicines. Like I said, we have to trust them when we know they're valuable and helping us clinically manage a health condition. Sometimes though the medicines are added with some uncertainty. Not sure if this is going to help. Let's try it. So that's where you really have to be careful that those medicines are truly helping and not just hanging on there and maybe helping, maybe not, but because they can cause side effects. So right, always and always bring up your questions. I also want to say, like, when I think about side effects, we have to look at everything. What has changed in their diet? What has changed in their eating and drinking patterns? So maybe other things can contribute to certain symptoms. But yeah, every situation is so different and unique. So you really have to take it on a very personal basis. But yeah, we have to sometimes bring up those questions.
Yes. We always talk about you have to have a team of people to help you in retirement, and the doctor was on the team, but now the pharmacist needs to be on the team. You need to have
absolutely. Yeah. And so to toot the pharmacist's horn, I think we're one of the underappreciated healthcare professions. People see us as dispensing medications. We're behind a counter. We're busy, can't bother the pharmacist. So I like to say a couple things. One, as a clinical pharmacist, I don't dispense. I don't work behind the pharmacy counter. So we can be in very, very different settings. People will see us in the hospital setting, of course, hopefully doing rounds and visiting you in your hospital room, but also in ambulatory clinics, that's growing. And then there's concierge pharmacists like myself who are actually in people's homes and providing a very unique service. But even at the pharmacy counter, the pharmacist, we are trained. We'd much rather talk to you about your medications and help you get it right and understand how to take it and assess for any side effects or interactions than to sit behind the counter having to deal with the prior authorization and the insurance situations, right? All the struggles it is to get the right health insurance for people and the right drug coverage. So take advantage of the pharmacist. And when we talk about the non-prescriptions, it's important that we cover that a little bit. But anytime you're choosing an over-the-counter medication or a dietary supplement, why risk it? Ask the pharmacist, is this going to interact? Is this a good product to choose for my symptoms? Take advantage of that knowledge, because we really have such great training. That's what we do for 6-7 years now. Most students are in pharmacy school for even 7 years to learn all this stuff.
Yeah, I think your point is, I hear you. It's not just the prescribed medications. It's all the things you take over the counter. The aspirin, the cough medicine, all of that, in addition to your supplements, your vitamin D. And everybody says you need magnesium and zinc. Well, those could interact with other drugs. You've got to talk about them. Got to put them on your list.
Yeah, put them on your list and interact with other drugs, but also possibly interact with some of your health conditions, right? So just an example, someone with very poor kidney function And sometimes that is age-related changes. It's just a natural decline as we get older. Other people have kidney disease for certain reasons. Too much magnesium could be dangerous, right? So just to make people aware that there's no, I think I can say this pretty confidently, there's no medication, no supplement, well, certainly no drug, but supplements most likely, that don't have some risk possibly with them, right? Just to, that we just have a little bit of that, again, that healthy skepticism, a little caution to talk about what we're taking. Yeah.
So what is polypharmacy? Can you explain that?
Love that word. So, polypharmacy. A lot of people are hearing it more and more. And when I wrote my book, I talked about how it's ready for prime time. It was out in Consumer Reports, at least talking about multiple medications, and it's out there. So polypharmacy simply refers to multiple medications. Poly referring to multiple, pharmacy referring to drugs, medications, rather than your brick and mortar pharmacy. So multiple medications. There's no specific official number of how many medicines constitutes polypharmacy, but we commonly accept the number 5 or more drugs. When we look at national statistics, it's really looking at just prescription medications. And I think people might find it fascinating that the prevalence, the number of people now taking 5 or more medications in that older adult realm is now up to 42 to 44%. 30 years ago, that was 13%. We have such a greater use, more commonly using 5 or more medications. It's concerning. So polypharmacy, and that's just people understanding what that means, and it's associated with negative outcomes, increased risk of side effects and interactions, of course, but even increased hospitalizations, decreased quality of life, increased risk of falls and dementia, right? Things like that, let alone death. There's been some studies showing it has increased the risk of mortality. So it's important to be aware that even the number of medicines you take on its own, those medicines can contribute to some negative health outcomes that are preventable if we can really look at the medicines and get rid of what may not be necessary.
I think, so tell me if this is true. I think I read somewhere that most of the drug trials and stuff, they happen on younger people. They're done on younger people. But as we age, our body handles medications differently. Is that true?
Spot on. And again, some of probably what I know I delivered some of that in my early chapters in the book. I definitely talk about those, the physiologic changes in our body. Our kidneys don't work as well. I mentioned that generally. Our liver, which transforms medications, may not be as efficient as well. And those are age-related changes, so that increases our risk of having problems as we get older and makes polypharmacy that much more concerning in older adults. And then that research piece is really interesting. And when I talk about why older adults are at greater risk of having problems, it's the 5th item I talk about is the not being included in the research. So yes, to investigate the effectiveness and safety of a new medication, it's hard. They want clean studies, if you will, clean situations where the person has, if it's a heart failure medicine, the person just has heart failure and isn't taking 15 other medications and does not have 3 other health conditions. So unfortunately, a lot of older adults may not be eligible for these research trials, which means once the drug comes to market, we don't have as much data in older adults. So it's a little bit concerning, and especially when doctors are prescribing this brand new medicine. And when I go to look at the information, like how many older adults has it been studied in? It could be as few as 60 patients, 60. It could be 100. And really, we need to have it studied in at least 3,000, at least 1,000, but ideally 3,000. And that's small, right? Once a drug is prescribed and marketed, millions of people will be exposed, and that's where we see these rare adverse events that could be more prominent in older adults, again, because of those physical changes. So yeah, it's definitely, there's so many pieces to this puzzle of why we need to be a little bit more careful with medications in our older adults.
And I love the idea. I think everybody, again, I work with people over 65. I think everyone needs to see a geriatric doctor. I think they're more in tune to these things. They have a little more time. But I know not everybody. There's not enough of them and enough geriatric pharmacists either.
We have that shortage, right? And so and the geriatric trained healthcare professionals have that better appreciation of all of the different facets that go into an older adult, the social concerns, our emotional well-being, as well as the physical issues. And there's, so much to being healthy. It's not just the physical health and the medications. It's where we live in our environment and having what stress level, again, do we have good health insurance? Do we have access to what we need? All those contribute to how we age and how successfully we age, if I can use that term, how easy it is or not.
Absolutely. Yeah, and it's not just all about the medications. Like you said, it's about your diet, exercise, all the things that we know, including sleep patterns, that kind of thing.
Huge. Yep, absolutely, Stephanie.
So the other thing I hear a lot about is prescribing cascades. Can you explain that or give us an example?
Yeah, it's a wonderful term. I'm glad you brought it up. So, and it fits so perfectly in with our conversation of is it the medication or is it just getting older? So, prescribing cascade, I think, is kind of self-descriptive, but it refers to a medication that is added to treat the side effect of a first medication, right? So someone is prescribed, I'll use a recent example, and everyone's taking it, so now I'll alarm everybody out there listening, but gabapentin, right? We use it a lot for nerve pain. So it's used an awful lot. Gabapentin, a more recent side effect that's only in the literature now, we didn't know about this initially, can cause some swelling in the ankles sometimes for patients, right? And if the doctor doesn't really look back at the time course, is it possible it was caused by the gabapentin? They might add a water pill to help take care of that swelling in the ankles, right? So that would be an example of a prescribing cascade where we're just adding medications when really we should look at the cause of that side effect. And if it's a medication, then that causes that prescribing cascade. And there's a lot of examples, and it's getting more and more attention in the medical world, but they're hard to detect sometimes, right? It's easy to overlook. You really have to look at the timeline. You might have to do a trial of stopping a medicine or pulling back on the dose, for example, to figure it out, which can be, challenging sometimes. But to me, I'd much rather figure out that the cause is a drug, that maybe we could switch it to something different rather than add yet another drug, which contributes to polypharmacy, right? So it all kind of goes together. So yeah, it's a really important concept. And I think if consumers are aware of the possibility of a prescribing cascade, when you go into your doctor's office with a new symptom, one of those first questions should be, is it maybe caused by anything I'm taking? That we want to look at that first. So it's a really important concept.
Oh, so let's talk about that. Let's say that if your doctor is prescribing a new medication, or when you're going in to try to talk to your doctor about these, what kind of questions should we be asking?
When you want to talk about the medications in general, or you have a new symptom, or
if you're prescribed something new, we'll start there. I just had someone tell me that they were prescribed something new and they said, nope, I'm on enough medications, I'm not taking anymore, which I completely understand. But maybe that was needed. Are there other questions we could ask?
Exactly. Yep. I love that. Okay, I got it. I'm with. So the couple questions that definitely line up is, first of all, so why would you want to prescribe this medicine for me? What would it be doing? And then I kind of already covered, well, is my symptom caused by something else? You always want to do that investigation. But the follow-on question, so why do you want to prescribe this to me? What happens if I don't treat the condition? Because sometimes it's not devastating if you don't treat it. Sometimes it's critical, right? Like you said, maybe that medicine is really necessary. So what happens if I don't treat this? Is there a non-drug way to treat it? Do we have to go to a medicine? If it's, I don't know, we can try back pain, right? Could I try ice or heating pad? Maybe. Maybe is there a topical that I could use, a cream or something instead, before going to an oral medication? So understanding what your options are, doing nothing, trying something else, non-drug. I always like to say, sometimes the doctors just don't think of that first because you have an 8-minute visit. It takes time, it takes energy, it takes behavioral changes, to change your diet or take on a new, heating pad. Who has time for this stuff, right? But if the patient brings it up, then the doctor will be reminded or know that the patient is open to other options, right? And then the other question to ask with a new medicine is, I think it's important to talk about, because of what we addressed earlier with the research in older adults, how effective will this drug be? Has it been studied in older people like myself, people with my health conditions and my other health conditions? And how likely is it to be effective? And if some doctors should be able to kind of pull out, give you an idea of, it can help 3 out of 10 people, or it can help 7 out of 10 people. And that'll give you a sense of what we know about how effective it might be, or that it's going to be a little bit of I'm not sure, hit or miss. We can try it. Let's give it a shot. But that's where you then need to jump in with, when are we going to reevaluate, right? Let's just not start it and I'll see you in a year and a half. We'll start it. I'll check back. Is it weeks? Is it a month? How long till I'm going to see an effect? And then what kind of follow-up is needed? So those are, to me, I know it's more than just a couple, but it's a series of questions. Certainly for me, I'd want to know, are there other options? And how good is this one drug option that you're talking about? What about some other options? So I think that'll help kind of get the conversation going of knowing, is this really important or not for me?
Yeah, I like that. It can't just be something that's advertised on TV and it's new and improved. Well, it may not be. Let me ask these questions and figure out this.
And there's a lot of and we have this drug advertisements is an important thing to recognize. Only 2 countries have allowed these direct to consumer advertisements, us and New Zealand. And it's very profitable for the drug companies. They wouldn't be spending billions of dollars a month on all these ads. And what's interesting, a lot of these drugs out there some of them are for very niche conditions. Some of them are for very common conditions, but are they any better than the traditional medicines that we have? Some of them are wonderful advances, but yeah, are we, we have this culture where the inclination is to say, what drug can help me versus what can I do to help myself? And a lot of our chronic health conditions are lifestyle based. We could manage many of them if we really looked at what were our daily activities. You mentioned sleep and diet and exercise and all that we're exposed to. Even, we can't control everything, but clean air and our hearing, hearing impairment, vision, all these things affect some of our long-term conditions. I'm thinking the hearing and vision, it's really dementia we think about. But aren't we all very concerned about staying cognitively mind intact as long as we can?
Yes.
It matters, right? We don't.
Yes. And it is so often that people are misdiagnosed with dementia because they just couldn't hear their,
Yep.
That's a whole nother episode we'll talk about, but
right.
it is very common.
But absolutely.
So are there any medications that we need to watch out for that maybe there's a risk of falls or confusion or things like that? I hear people talk about, my parent had a UTI but they thought it was dementia and just all kinds of things like that. Are there any examples that you have for us to watch out for?
Yeah. There are definitely medicines we know of as fall risk drugs, so that would increase the risk of a fall or even a little more subtly, just unsteady gait. And then we have another very similar, a lot of overlap, but another group of medications that we are worried about for cognitive changes, so that affecting delirium or dementia, and even depression. Some medicines very subtly can affect mood. So it's important that we're not worsening any of those issues, but that are very concerning to all of us as we get older with medications. So what drugs? There's a lot of drug classes I could talk about. Some of them are easy to share, and some of them are a little bit more complicated. And I love, I've got my PowerPoints ready to go when I give talks and stuff, because, it gets confusing. But think about any medicines that can cause drowsiness, can increase that risk of falls, right? So
like muscle relaxers or things to help you sleep, those kind of things.
Exactly. So sleep medications, muscle relaxants, opioids a little bit. So those strong pain medications is certainly when they're combined with another medicine that it can cause drowsiness. I mentioned the gabapentin. There's the seizure medicines, of which gabapentin and pregabalin, again, two commonly used medicines for nerve pain as we get older rather than seizures. Those medicines are in that list. A group called benzodiazepines, which can be used for anxiety. Also increasing fall risk, but it's more subtle, are some of our antidepressants. So the SSRIs, those serotonin mechanism medications, they're on our fall risk list of drugs. Typically people do okay, but the more medicines of any of the ones we just talked about that a person's taking, certainly it's additive. And then the fun one, I'll mention it to the listeners, and then they can go get my book and look into it. Anticholinergic medications describes physiologically how they work in the body, but these drugs have this group of side effects that can increase fall risk, but also cognition, our dementia and confusion and memory risk. We use these anticholinergic medications. We use them for breathing conditions, for urinary incontinence, for some of our antihistamines, allergy medicines, over-the-counter products have this type of action in our body that can increase the risk of memory problems and confusion. And this is a fun one just to get the listeners to think about. Some of our OTC products are major problem medicines for older adults. The sleep drugs that are out there, OTC. So to mention Tylenol PM or Unisom, those types of products, it's that PM piece of the Tylenol PM that has this it's an allergy medicine that if we took high doses long term, it can contribute to confusion and decreased memory. And a lot of patients I talk with, there's a gentleman I met with recently who was telling me he's had sleep problems for the last 6 months or so, and he has added Unisom at night. But before he gets to the medicine list, he's telling me how he's worried about his fall risk. He's a little bit more unsteady, and he's noticed his memory is off. So when I got to his medicine list, I have no doubt that Unisom was contributing to those symptoms. So fall risk is drugs that cause sedation. And also with the fall risk, I mentioned earlier the person who was on too many blood pressure medicines, and after lifestyle changes, she was over-treated. Sometimes those certain blood pressure medicines can make us feel dizzy when we stand up quickly. So sometimes we have to think about blood pressure medicines when we think about fall risk also. And so on the cognitive side, because I think that memory piece is really important, to not add any medicines that can worsen it, because certainly word recall, that's natural aging, right? It's harder, or things are on the tip of our tongue, and that may not be a bad signal. It's just getting older, but why add medications that can worsen it? So knowing that some of those over-the-counter products can contribute, I think is a great tip to make sure people talk to their pharmacist, make sure they're not taking something that can worsen it. But benzodiazepines, so drugs like Valium, even Xanax and lorazepam or Ativan, which a lot of people might take low dose as needed if we take that long term, it can affect memory. And as well, likewise with the seizure medications and some of the others. So we need to think about drugs that might make us feel a little foggy. I feel a little bit off, not quite as clear or sharp. Definitely need to look at the drugs. And then I guess just the overall piece is, because I can't tell you every medicine, and that would be unwise to do that. I mean, I have some of these listed, the higher risk ones are in the book, but always just go to your pharmacist who's very accessible, have them look at your medicine list, or ask the physician very pointedly, I'm worried about my memory, I'm worried about my balance, let's look at the medications. And that can help really focus in a little bit more.
And that is a perfect question to ask. So if people want to get a medication reviewed, go to their doctor, which they should do this, right? Go to their doctor, go to their pharmacist. And you mentioned in-home visits. Tell me more about your service, because you're here in St. Louis. And I know that there's people like you in a lot of different areas, but how is yours different? What do you do?
Yeah, so it's a very, I don't want to say concierge, it's a very tailored service to patients who really, if it's an easy question, most likely you've got your retail pharmacist has you covered, or the doctors answer the question. I work with patients who typically have a lot of health conditions going on and take a lot of medications from many different doctors often. They feel like no one's really listening to me. I'm concerned that I'm taking too much. What all is needed? Is it helping? Is it interacting? And like I said, they just need a little bit of advocacy, I think, with their healthcare team. Like, hey, these are some possible concerns with the medications. So like I said, it's an in-home visit, and I chose to do that because I wanted to counter that very brief in the clinic, short visit, your time limited of sorts. And I want to look at all the medicines you're taking. And you're not going to bring all your pill bottles into the doctor's office or to the clinic or to the pharmacy necessarily. And if I'm in your home, I can also see, how do you have them organized? And invariably, when I'm working with someone, I'll ask, are you taking anything at night, or anything without a prescription, or are you taking aspirin? Someone will say, oh yeah, I'm taking this, that, and the other, and then they'll go grab it. So then I can really look at everything they're taking. Seeing the supplement bottles rather than just a list of supplements is also really important, because every supplement, they're not standardized. So if you're taking fish oil, well, which fish oil, how much EPA and DHA, what's really in that bottle? So I need to see those labels. And it's in an unhurried environment. So I take, a good hour to an hour and a half, even depending on the time, the number of medicines, to understand what they're taking, where their questions are, and then put together my report. So I really rely on the patient to give, and the family member, if someone, a spouse or a family member is there, to give me as much information about that person's health and history as they can.
Do you have anything that we didn't talk about that we need to? Anything that's important that we've missed?
You covered a lot of the fun words I like to talk about. If I can just share the concept of, so we talk about polypharmacy and how too much can be bad, or sometimes we take medications longer than necessary, or we continue them because no one really stopped to say, hey, is it time, should we stop it? There's a new science, if you will, movement in pharmacy and in medicine called deprescribing. And I just want to share that term, deprescribing, because it's kind of like, it's one of our tools that we have to address the problem of polypharmacy. When we have too many medications and some are harmful for us, deprescribing is looking at any drugs that are no longer necessary or that might be harmful, and how to either reduce doses or maybe even stop these medications. So that the concept of medicines shouldn't always be for life. Not necessarily, we're meant to take them for the next 30 years. We talked about re-prescribing at the beginning, right? Really re-looking at, do we intentionally want to continue these medications for you, patient, person, but also have you changed with your age, with your other health conditions and medications, that maybe we need to lower a dose for you to make it safer, or maybe the drug isn't even needed. So how do we safely reduce a dose slowly over time. And typically, unfortunately, we can't always stop medicines abruptly. We have to do it very carefully, one at a time, lower the dose. So this concept that you're not always on your medications forever, I think is important, just to kind of put it out there and have that conversation. But otherwise, yes. I think we've covered a lot of the important stuff, just for people to be aware that medications can be the problem. Yes, they can do wonderful things, and we have to remember that, but are we taking them properly at home and making them as safe and effective as possible? So yeah, thanks so much for letting us talk about all this great stuff.
Yeah, I think it was great information. I can think of lots of clients who benefit from a review. For sure.
Yep, absolutely. And I like to say, have your annual review with your doctor, but pharmacists are able to look at the medicines outside of having prescribed them. So we can look at medicines maybe more objectively, plus we have that additional expertise for sure. So check with your local pharmacist, check with your Part D plan. If you have Medicare, you might be able to get a comprehensive review. And then there's people like me who have more of a niche service where we will provide these individual reviews either at an office site or in your home, but often it won't be covered by insurance. So I always like to mention that to people. There might be a charge for that, but more eyes on your medicine list when you have any kind of concerns is only going to be helpful for you and beneficial, I think, long term.
I think so too. That was great information. Thank you so much. I just remember getting older is only part of the story, and sometimes it is your medication. So ask questions, be your own advocate, or help your loved ones. And if you found today's episode helpful, just share it with someone who is aging or who is taking care of an aging parent or spouse. And thank you for listening.
Great. Thanks so much.
Thanks for listening to another edition of the Aging, Healthcare, and Everything in Between podcast. Please share this podcast so that others can benefit from the content. Please also leave reviews, as feedback is important to me. And if you have any suggestions for a future episode, email them to s.pogue@stlouisinsurancegroup.com. Thanks again for listening, and I look forward to bringing you more valuable content soon.